Can you able to see my screen?
Yes, ma'am.
Okay, thank you. How are you all?
Yes.
How are you all? Can we start? Hope I'm audible to everyone.
Yes, ma'am.
Yeah.
Yes, ma'am. You're
Today's
audible.
schedule.
Yes, ma'am. I'm good.
Yes. Thank you. Today's session is about narcotics and Schedule X and statutory handling. This is something important where it leads to legal complaints to the hospital, and sometimes due to narcotics and all, it may leads to seize hospital and pharmacy as well. This is something most important, and it reflects our legal things. And you might be heard about the narcotics in news. And have you heard about narcotics? See, this is something where people get addicted with the drugs, and government has taken more decisions to prevent proliferage, and there are separate process to handle it and for the storage also. So let's see in detail what are narcotics, what are schedule X drugs, and how we have to handle those medication. And there will be a separate storage, and separate norms will be there, and it works under separate laws. See, Schedule H, whereas H1 and all, they works under separate law, whereas this NDPS, this works under the NDPS Act. So let's see. Narcotics are medications with high potential for abuse and dependence. Yes, that is what I told you. Like, usually narcotics leads to addiction. See, Schedule X, basically those are all are sedative, but these kind of drugs leads to addiction, and these are regulated under NDPS Act, that is Narcotic Drug and Psychotropic Substances Act. Hope you have heard about this in the news, or else whereas in the newspaper or any articles till now. So the pharma professionals should be aware of these narcotics in and out, and what are the regulatory bodies, and what are the norms to follow it. You must know, and this is separate chapter. Whereas in GCI, wherever it is, wherever we do have certain norms, whereas the regulations, this is something different where we are supposed to see keen. Schedule X drugs are similarly controlled under Drugs and Cosmetics Act. See, there are NDPS Act and at the same time Drugs and Cosmetics Act. These most of the drugs will comes under drugs and these cosmetics acts, whereas this narcotics, that is especially that will be regulated under NDPS Act. Though it is under Drugs and Cosmetics Act, you might be heard about your in your studies, that might be in first year, all the legal norms and laws. So these will be ruled by NDPS Act, and there is separate legal framework. There are key legislations we have. NDPS Act in 1985, that is Narcotic Drugs and Psychotropic Substances, whereas Drug and Cosmetic Acts 1940. In 1940, those are into the Schedule X drugs, whereas Drug Controller Administration, where we have all the remaining drugs will be having in this, that is a 1950, it got launched, and everything comes under DCA itself. As per NABH accreditation standard, this comes under medication chapter, whereas DNB and statutory body requirements, these requirements are used for the audit and training. These are the legal framework if we are placing narcotics at our work, at our hospitals. And the purpose of these acts are to prevent misuse, diversions, and ensure traceability of controlled drugs. See, as we this is something important where it is leading to addiction to the people and to the generation. If you see, if a patient got habituated with narcotic patch or else any fentanyl patch, then they always feel like taking that, which relieves their body pains. So that is the, it may leads to addiction, and it may leads to misuse also. And to ensure the traceability and the control of the drugs also, there is a certain registers and statutory being followed by them. And these are the examples. See, let's see till now. Schedule Basically, Schedule X drugs comes under Narcotics, psychotropics, that is benzodiazepines, comes under Schedule X drugs. In that, narcotics has a separate storage, separate act, and everything. So, narcotics includes morphine, fentanyl, methadone. That comes under NDPS Act that regulates with the governing body, that is NDPS Act. Whereas psychotropics drugs, lorazepam, clonazepam, diazepam, whereas haloperidol, if you observe, these drugs cannot be given without current prescription. This is also comes under NDPS drugs. And if you observe, alprazolam, that is a benzodiazepine, and which comes under Schedule X drugs, and pentazocine. Most of the brands will be there in these with Fortwin or Phenargan, like that we may have. So if once people got habituated with that, then they always feel like having this kind of Schedule X and narcotic medicines. If you observe any geriatric patients, if we give alprazolam with a minimal dose, then without that medication they can't sleep, and they slowly get habituated with that alprazolam, and without that they cannot sleep. So these three categories leads to always addiction, and which cannot be used unless until it the condition, clinical condition is mandatory, or else if it is for a time being use only, we cannot use on a nominal sake or else for a dosage wise. As we use different medications, antibiotics for 5 days, we have certain dosage for different things. Whereas these three categories, we don't have any dosage at all, that fentanyl is supposed to use for 5 days, it leads to patient may leads to resistance. There is nothing like that. That these all are the medications where we use for if necessary, that is SOS as per our language. And each class has unique documentation and storage requirements. See, we have discussed Schedule X drugs in the previous classes, when we have discussed high risk and emergency drugs, that will be labeled in a radium color, where we can store in a pharmacy with in separate rack. And at the same time, psychotropics also, psychotropic Schedule X drugs both comes under same thing, and we can store together. Whereas narcotic storage is something different, and documentation is also completely different. And whenever we use this Schedule X and psychotropic drugs, there will be a ledger of usage, ledger in the sense to which patient we have used, and what are the bill and what is the quantity we have used for. Whereas narcotic, there is a separate register which was given by the government itself, that is a DCA, drug controlled administration. And let's see in detail how narcotics are supposed to store and access. Narcotic storage requirements, usually you may get confused with high risk and narcotic medication. High risk medication should be stored in lock and key, whereas narcotic is supposed to store in separate fridge, that is not fridge, sorry, separate rack, that is double lock and key, and that should be made with metallic cabinet. Because if it is something PVC or something like that, it can be broken at any time, or else any proliferation may occur. So always it should be in a metal cabinet. If you see like almara with a metal body, those are always to be prioritized. And two keys will be there. One key should be with anesthetist, and other keys should be with pharmacy in charge. And if pharmacy authorized pharmacist or nursing in charge, any of them can handle this, but they should be authorized nursing or authorized pharmacist itself. And that separates from the regular drugs. Whenever we use separate storage, that is in metal cabinet, then it has separate place and separate uh, storage also. Always it should be stored in double lock and key, and whereas they those keys should be maintained very carefully by the healthcare professionals. And the keys, one keys will be always with anesthetist, because he is the authorized person to use those medication and to prescribe those medication. And the next thing is access log. Whenever we use that keys, there will be a register on what purpose, at what time we are opening, and that should be always in the CC vigilance. If it is not there, then if we get any proliferage, then we don't have any evidence who has opened it, or else whether they may not write in the register as well. So in that condition, we can track CC if we have a backup. And this is the separate storage thing. And whenever we go for audit, usually pharmacy professionals will go for an audit. Whenever we go for an audit, that is an audit tip, always cross check the physical stock versus register. As I told you, there will be a separate register maintained whenever we issue those medication to the patient. And if you go to the pharmacy, if you are working at some places, if you are doing your internship, you can go to pharmacy, you can apply this, all this whatever we are discussing, you can apply there, and you can go for an audit, surprise audit, as an NABH auditor. If you go through this physical stock, and you should ask them, show me the physical quantity, and you should check the register. And if that balance is getting tallied, then it is accurate. If not, that is not an accurate thing. See, documentation, we are talking about till register and how the register is supposed to be maintained. Let's see. This is narcotic register form 3C3D. This form 3C3D will be always published by the, that will be issued by the government itself. We cannot make our own register. We cannot write in our own register. This form 3C3D will be with authorized stamp. That is a DCA stamp will be there. And there will be Schedule X register. One second. Yeah, there will be a Schedule X register separate, and whenever we issue medication, that is narcotic medication, we'll write that is this. Here we have a format. If you can see the slide, there is a date, drug, batch, and received. How many quantities and how many quantities you have issued, balance, signature. If we go in detail, date at what time we are issuing, or else whenever see, suppose if you have given 2 vials to the nursing staff, and these medications cannot be given to the attender, patient attender, or any unauthorized person like housekeeping or any shifting boys, we cannot give it to them. We should give only to the OT, anesthesia technician, or else nurse in charge. Except these two, or any doctor, except these healthcare professionals, we cannot give it to the unauthorized person. And whenever we are issuing those medication, you must see the prescription. That prescription always should be by the anesthetist only. A non anesthetist cannot write this narcotic prescription. And the details should be written in detail, that what medicine has been written in this. And if we go to the format where we are supposed to maintain in the pharmacy is date of issue, and which drug we might be having, we might be issuing different drugs. It might be fentanyl, it might be morphine. In fentanyl itself, we have injections that do with different doses, and the patches as well. And batch, we do have, every medicine has their batch, own batch, and the received quantity. Received, this column will be used if they have returned without use, or else if you have given 2 injections to the nursing staff but only one has been used, another has not yet used, and they are returning it to the pharmacy, then how many vials you have received, you should write it. And how many vials you issued to the patient, that is 2 or 1, how many you have, the quantity, it should be mentioned in the register. And this balance, see, if you have 500 injections in your place, then you have issued 2 vials, how many medications will be there in your balance? See, there are 500 quantity, and you have issued 2 vials to the nursing staff. How many left over? Am I audible? 498. Yes. So you have to write this quantity as how many vials are there in your pharmacy. That is a balanced quantity. And this signature is authorized pharmacist who is holding PCI certificate. If you misuse all these things, then pharmacist and the anesthetist will be, uh, their license will be seized and action will be taken on them. That is the reason the signature with authorized PCI, holding, the person who is holding the PCI certificate itself. And there is a thumb rule on it. No overwriting. If you observe any overwriting, you should not issue those medications in prescription. and use ink only. We cannot use pencils or anything. They should use only ink pen, that is ball pen, and corrections must be signed. Always, if a doctor has written fentanyl 25 mg, but 50 mg is actually needed to the patient, then they have cut with the one line and 50 mg was written in a below the 25 mg, but we are not sure who has done it. So the person who has corrected, they should sign. If you observe that signature itself, then you are supposed to give 50 mg. If not, if there is no authorized signature, then you cannot consider that prescription itself. And this is the format for the registers and prescriptions and dispensing rules. See, let's go in detail how that prescription is supposed to be. Only prescribed by authorized medical practitioner. Who is medical practitioner here? Who is medical practitioner here? I just told you now. You can talk, you can unmute.
Ma'am, consultants.
No, consultants is not authorized for the narcotic prescription. Only anesthetist should be written, and even that prescription should include patient name, diagnosis, a proper name of the medication, dose, and doctor's name, their registration number, and their stamp along with the date. If anyone is missing among them, you are not supposed to issue, that is dispense those narcotic medication. And if you are encouraging all these things, then their license will be seized, and even a pharmacy also can be seized whenever drug inspector has come for the audit. And no telephonic or verbal accepted. See, if any consultant said on phone that he might be your friend or someone else, they said that you can give on phone, or else any verbal orders. He told you that you can give medication, I told you no. No, you cannot accept it at all. See, whenever consultant has their own norms, pharmacy is always have their own guidelines where you must follow, and everyone should follow all those rules. So no telephonic or verbal orders accepted by you, and a proper anesthetist signature of narcotic prescription is valid. Without that, it cannot be valid. And that, always remember, doctor name, signature, stamp, and their registration number, that is mandatory. We have to know. If you observe, most of the consultants don't have their MCI registration too, and they are not licensed doctors. That is the reason this registration number became mandatory. And there will be two prescriptions usually. um there will be a carbon copy used, and one prescription will be kept at your place itself, and another prescription, that is stamped copy, xerox copy, will be kept in your place. And at the same time, whatever the carbon copy will be given to the OT people, and this original prescription should be kept aside. So there will be a two copies always in your pharmacy, and one carbon copy, if needed, then that will be given to the wards or wherever the usage of medication is. And those prescriptions should be retained for 2 years. Whenever the drug inspector has come, whenever anything has come for the inspection, we must randomly, they'll pick a number, and we must show that prescription, so that their audit will be a compliance. And on a legal note, dispensing without valid prescription is equal to the NDPS violation. See, we have a strict rule. What is that NDPS rule? They must have a separate prescription from the anesthetist. And if we don't follow that, and if any telephonic or verbal orders are given to the patient without prescription, that is a NDPS Act violation. And the punishment is punishable by imprisonment and fine also. So that will be there for pharmacist, and at the same time license, at the same time managing director of the hospital too. These are the rules for the prescription and dispensing. And return, see, if we say about the return, see, expired damaged drugs quarantined immediately. If medications, suppose we should not wait until medication get expired, with the near expiry itself we have to return. And if we are supposed to return any register or anything to the vendor in return, then there will be a separate return register should be there, and return to manufacturer under the acknowledgement. What is that acknowledgement? Is whenever you get these medication, you'll be getting through the TP license, that is a transport license with separate license. We do have narcotic license separately. If we are holding this, then we can get these narcotic vials. If we are not holding those statutory, we cannot get those vials too, and we are not authorized to use those medication in our place. So there might be some discoloration or any drug recall or anything else. When you are supposed to return to the vendor, there will be a certified copy from your letterhead that these are the vials which are returning to the manufacturer due to this so and so damage or expiry or any discoloration or anything else might be the reason. There should be a proper acknowledgement from these authorized managing director or whomever it is, the person is with the license. They should write their names and the stamp should be there. Hospital stamp should be there for mandatory. And if it is destruction, yes, as per NDPS Rule 14 and 15, conducted in the presence of authorized officer. See, when we are destruction, that is a condemnation policy, we call it as. Even empty vial also. Empty vials cannot be discarded like other medication. These medications, why? Because even empty vials, a small amount of vial will be there. The people who got addicted, they used it. In fact, they used it was leading to a misuse, and which was creating some mess in the society. So what happened, those empty wells became very strict, and there will be a separate place to discard those medication, and that will be under supervision of a proper officer, that is drug inspector or any area director. And if you are the owner for your hospital, that is you are working as a pharmacist or else you are in charge, then you must discard these things, destruct these things with under the supervision of drug controller. At the same time, pharmacist, authorized pharmacist and the quality representative should be there. With these presence only, these medication or else empty wells can lead to the destruction, or else we are not authorized. And we do have a certificate, we do get the condemnation certificate from those government itself. And those wherever we are discarding, we get those condemnation certificate, then that proves that we have officially discarded. It cannot be discarded randomly like other medication, and that certificate should be maintained for lifetime. How many times we have discarded and what is the reason for discarding the medication. So there will be a depth analysis where we have a committee like PTC we have discussed in the very first session. In that, all the discussions will be going on, why these medications were leading to discard, why these are ordering without any estimation, why inventory is not being maintained properly. So yeah, these mostly the reasons are, if any medications are leading to discard, there might be a expiry itself mostly. If it is not getting expired or else any discoloration or any damage, then we'll return it to the vendor. But when the situation has come to discard is expiry itself. So let's see how we have to manage expiry medication. Always maintain expiry alert register whenever we use medication. The first in first out process to be followed, that is whenever we get the latest medication we should keep behind, and that is first expiry first out. Both things, the medicine which are with the near expiry, those are supposed to be used on prior, and the medication we receive on the latest things, we should use it later. Obviously the medication where we are using in the latest things, that will be with long expiry. So these process should be followed in the pharmacy everywhere, but in narcotic you have to be more keen. That is first in first out, and for FIFO, that is first expiry first out. These methods can be prevented this expiry management. And quarantine expiry stock immediately. See, if we don't check these, if we don't quarantine in a separate place or something else, then it may leads to the usage also. Whenever we are in hurry, we might not be checking. So there will be a common practice, that is a common mistake which may happens from the human, that it might not be intentionally, but sometimes it may leads to the mistake. That is the reason we have to keep in a separate isolated place, that is we have to quarantine expired medication immediately. And the next thing is we have to put the label not for use. Why we are not supposed to use? Whenever the label we with the red tag or something, we should keep that medication as not for use. That clearly mentioned, that gives alert to our brain. Okay, these medication are labeled as not for use. This is something where we are not supposed to issue to the medication. So usually these labels give some alert. That is the reason NABH has made a different color coding. See, whenever you see multiple colors, the color which is attracting your eyes or your brain, you obviously it's something kind of alert will be getting in your brain. So whenever you are using all those things, coloring, color codings and all, so that it may reduce to the medication errors, and it may leads to the safety to the patient, and like patient at the same time, uh, employee safety, which is reducing our legal things. So it might be useful for in many ways, in either ways, either from patient side and at the same time employee side also. So this is the expiry management for narcotic. And if you go for audit trials and compliance, how, see, you are an auditor, right? A pharmacist must be an auditor, and whenever you are getting into the pharmacies as an ABH auditor, you must know what are the tips and what are the activities. You must know this. So there are few activities which are supposed to be done during audit. Always pharmacy in a daily basis, they have to check physical versus register, whether it has given to the right patient, and the bill was stored or not in appropriate condition, and the remaining full vials were stored in a separate lock and key or not. So these should be checked on a daily basis. And monthly audit should be done by the pharmacist, that is in charge. Pharmacy in charge should be doing the random audit, and quarterly internal auditor from NABH, they'll come and they'll audit it. And annual inspection by state drug controller will be there nominally, but we never know when drug inspector will come to our place, and whenever he see randomly, that should be ready 24 by 7 all the time. And if you get any non compliance among these four, then you must report immediately. If any discrepancy or anything you found, then immediate notification should be provided to the higher officials, and investigation should be done. Why this medication were not stored properly, why physical quantity is not matching with empty vials, why register is not matching with physical quantity. There might be some proliferage only, there might be some misuse, or else they did not follow any SOP. So you have to hunt what is this, you have to investigate what is the situation. And kappa, what does it mean? Corrective action and preventive action. What corrective action you have been taken as an auditor, what preventive action you have taken to overcome those kind of mistakes in future. So you must tell all these things in a reporting. And if you go to the legal liabilities, under NDPS Act in 1985, improper handling or record tampering. That is, see, if you don't handle these medications, that you might not be storing properly as per double lock and key, or as per norms, as standard norms, government norms, or else you are not keeping the records. Whenever the drug inspector has come, they are checking. Whenever they have come to your place, the vials are 490, but in the register you have 490, but the prescriptions are only 300, or else 480, 10 are missing. So you are improperly handling those medications and the record tampering as well. So the immediate action, the punishment is imprisonment up to 10 years plus fine. And unauthorized possession or diversion is something criminal liability. See, if these medications were used by unauthorized people, and if it is dispensed by unauthorized, if you have dispensed to the unauthorized person, anywhere from the consultants. Instead of anesthetist, consultant has written, or else duty doctor has written this prescription, and you might be deviating the role, that is without anesthetist signature, pharmacist has dispensed the medication. So it is a straight away criminal liability for pharmacist, doctors, nurses who are involved in this process. Three people will be taking those actions, that is a criminal liability. And if you miss ampules, missing ampules or unrecorded balance, then audit, it is straight away audit failure. Whenever you are unable to track these missing ampules, if you check on a daily basis, if you record everything every day as a balance quantity. See, today we have issued four medications out of 500, then our balance stock is 496. Then tomorrow you must see, after coming to hospital, the first work, you must see the narcotics, and you must see the register, and you must see the physical quantity, at the same time prescriptions too. Then if everything is tallied for four things, that is prescription, register, empty vials, and physical count and system count, if these five are getting tallied, then your narcotics are maintaining in a compliance. If you are not checking on a daily basis, you can't even identify how many vials have been missing, how many unrecorded balance are there. If everything has piled up, you cannot do anything. And a lot of things have piled up at a time, and you can't do anything at all, and that may lead to the reportable offense, that is audit failure. So whenever you couldn't maintain all these things, you are straight away leads to the audit failure, and the pharmacy in charge will be taking action, and the person who is in the certificate, that is an statutory license, then those PCI certificate will be seized, and those certificates will be cancelled. So hope you are understanding why these many acts are there for the narcotics, to just to reduce addiction and to improve proliferage. These many acts were being implemented, but still proliferage is going on in different ways. So these are the liabilities which were taken by the government. Immediately they will be punished. And the restricted access and security measures, till now we have seen how these are used and what are the legal norms if we don't follow. So there should be some restricted access too. Whenever these medications are supposed to be stored in separate place, there will be a dual key system, one with pharmacist, one with nursing supervisor, usually in the night times, but one should be always with the anesthetist. But for better understanding for yourself, I kept for the nursing supervisor, because both people will be carrying carefully, and no unauthorized personnel allowed. See, a nursing supervisor cannot come, or else a nursing department cannot come, or else any respiratory or anyone cannot come into that place except a pharmacist. Pharmacist is authorized, pharmacist owner is owner for those narcotic cabinet, and they should, authorized pharmacist should handle those register stock, and they must access logbook. Yes, we do. We must have logbook whenever we use medication. To use it, we have to maintain logbook, that at what date we have opened, and what is the purpose, and how, who did open this, their name, signature, and time, date. This is the logbook for that access, that is a restricted access. See, if you go to locker, bank locker, whenever you are supposed to open, though that is your locker, there will be a logbook when you came, when you have been used, and what is the time and everything. So that is how you must use all these logbooks, uh, and that should be a tracking record, who have used this and at what time, so that if you get any doubt, so that you can straight away go to that person, and what is the situation, you can investigate. And use of biometric access recommended. So as we discussed, only authorized pharmacist is allowed, no one can be allowed that easily. So whomever the authorized pharmacist will be there, there should be a separate biometric access. Without biometric access, they are not allowed into that place, and that place should be always in a CC monitoring for the narcotic cabinet. See, usually CC will be there in either directions or in a different directions, whereas these should be there with a it should be visible for the narcotic cabinet, because we should understand who is coming, who is opening this almara or whatever it is, and who is writing logbook. So that should be visible. We must place CC camera in such a way where it can be easily tracked, so that we cannot track from the back end. Sometimes it cannot be placed in a dark place or wherever it is which is not visible. So the CC monitoring should be always placed with a for a narcotic cabinet, where people can identify the authorized person is using or not, or else a logbook is maintained, is being tracked or not. So it should be visible to the people. And this is the security measures we must follow. And the common compliance and non-compliance in this is, see, non-compliance for the narcotic register, and there is some impact and how you are supposed to prevent. I have written these things. Improper register maintenance. See, if you are not maintaining the register, or else if you are overwriting, or else no authorized signature from pharmacist, that is straight away legal penalty. Legal penalty in the sense, something you'll be getting into the imprisonment, or else fine, or else your certificate might be seized. So for this preventive action, you must do audit on a regular basis. And unauthorized access, this is diversion risk. If unauthorized person is using, this impact is into the diversion risk, where you people are not following a proper appropriate rules, and it is leading to the diversion. And preventive action for this is dual control. See, only two people should use, that is authorized pharmacist, only two people should handle this entire narcotic medication, so that we can easily identify if two people are there, either first one are using or second one are using. If it is accessible to multiple people, we cannot track. So that is the reason we must keep only dual control. And delay in return of expired stock, that is regulatory violation. See, if we are not using any required quantity, and still those medications got into expired, what it is leads to the impact is regulatory violation. That is, we are not quarantining those medications, and which may leads to the effect to the patient in emergency, we may give it to the patient. That is the reason the preventive action is, we have, whenever we found expiry medication in our place, we should immediately quarantine those medication with a label called not for use. That is a preventive action, where that label might be giving some alert to our brain before giving it to the patient, or else before using it to that medication. And missing prescriptions, that is non-traceability impact you will be getting. And prescription tracking, see, as I told you, always the prescription, first prescription is unauthorized or not, then whenever you are issuing the medication, your storage, that should be in double lock and key. And after issuing those, you must write a proper, you must maintain a register. And after maintaining those registers, whenever you get a written vial, that is an empty vial or full vial, you must you must maintain a register. Whenever you follow all these things, then you can overcome non-compliance, and you can be always in a care, in a safe mode. If any prescriptions are missing, see, if there are 10 patients used narcotics, and 10 we were written in the register, at the same time physical vials and the register is being maintained, getting tallied, but prescriptions, two prescriptions are missing. So what happens? So with unauthorized prescription, or else without prescription, we have given that medication. It leads to the non-compliance itself, where we are not following those prescriptions and authorized process. So if we are missing any prescriptions, then that may impact non-traceability. And for this, preventive action is on a daily basis. The simple preventive action is daily basis audit. That is regular audit, morning and evening, and that should be controlled by only two people, not multiple people, just to track the things on a properly basis or not. And the next thing is immediate quarantine. If it is written, or else if it is expiry, if those medication are supposed to return it to the vendor with drug recall, or else any damage, then the label should be done for those medications immediately after quarantine. You must use the label called label for not for use, and with the proper some kind of color coding you must give, so that whenever we see that white, usually white we prefer in medication in pharmacy to label, so these color codings will impact our brain where we should be so alert. And yeah, to summarize today's things, we have scheduled what is NDPS and how we are supposed to be handling. And these NDPS and Schedule X handling leads to the legal obligation. And you must maintain strict documentation and restricted access. And every discrepancy must be reported immediately to the higher officials. And this always training is always preventive control, where in charge cannot be there in pharmacy always. And audit is a mandatory which will be used as a preventive measure. Internal audit ensures legal safety. Before One second. Before we getting into all these legal things, it's better we audit internally on a daily basis and are in charge or internal audit team, and we can maintain readiness always whenever the auditors has come for the accreditation or anything for the legal safety. If any drug inspector has reached your place, so anytime you can keep the things ready and you can maintain accreditation readiness always. So this is all about NDPS, which is most important in the hospital to maintain compliance and to maintain a legal compliance. What I can say, where healthcare professionals should supposed to handle this, unauthorized are not supposed to. Even non-pharma people are not allowed to use. Where these are supposed to be stored in a separate double lock and key with a metal body, and one key should be with anesthetist or nursing, and one key should be with pharmacist, and day-to-day registers to be maintained, and empty vials, written vials should be tracked, and expiry or damage that should be quarantined immediately. And the label for after you should be give that not for use, you should give that label. And whenever you are discarding those narcotic, you cannot discard those medication randomly. You must discard under the presence of a proper authorized administrator that is from the government, and where you are supposed to pharmacist and the quality representative must be there. And after discarding those medication, you must take the certificate, that is a condemnation certificate will be provided from the government or any what is that biomedical places. You'll be getting a certificate, and these prescriptions should be maintained, that should be retained for 2 years, and this condemnation certificate should be there always lifetime. And let's go for the case studies in detail. Yeah, this is hope you have understood. Let's go for the case study. See, during internal audit, 2 ampules of morphine are missing from the ward register. No documentation found. What is your audit findings in this? Can anyone tell?
Lack of proper documentation, ma'am.
Very good. Next. Very good. Fantastic. Next.
The staff also didn't check the register
Very good.
properly.
Very good. Next. See, register not updated for 2 days. If it is updated on a daily basis, then they would have tracked morning and evening before going to the leaving workplace. They must check. So, what is this displacement of record handling? Yes, that is the reason. First of all, registers, they did not update registers on time. For 2 days, they did not updated, and the stock physically short. And what happens here? Nurse on duty is unaware of handling protocol. So these are the audit findings. So what you are supposed to do for the preventive things? Legal implications. See, This breach of NDPS compliance must be reported to the controller. If you are if any two vials are missing, if any somethings are missing, then you must immediately report to the drug controller, so that you may be in a to reduce the all the punishments which were then it may be possible penal action on the pharmacist in charge, because obviously pharmacist is supposed to track on a daily basis how with the opening stock and the closing stock, and they must write register whenever they write register on a daily basis, and the main role is to tally all the prescriptions, register physical vial, empty vials at the same time, the whatever the physical quantity and the system quantity is. So if you are not going to do for couple of days, then that is a huge gap. So obviously pharmacy in charge is responsible, and some penalty will be given to the pharmacist only. And here loss of NABH accreditation points. See, whenever yes, these narcotics has come into a separate scenario just because of all these proliferage, and there might not be any register or any ledger to which patient it has been used, and very young patients, young generation are addicting to the narcotics. If you see morphine, and now ketamine has turned into the narcotic, fentanyl. So just for simple sake and unnecessarily it was leading to proliferate. So these they have certain rules which are not being followed. That is the reason this act has come into a more compliance, and those must to be reported on a daily basis. And if sometimes if drug inspector has not checking on a periodical basis, then they may lose their job also. That is how it has become now, and this is complete different picture from all others. And here corrective actions are here immediate investigation report. What corrective actions? The investigation, as I told you, why it is missing, either due to unawareness of unawareness to the nursing team or pharmacy team, or else if any really proliferage occurred in the pharmacy, or the person who is carrying from the pharmacy to nursing, or else in the department, we never know. So we must investigate the things, and we should find the root cause. And the thing is staff retraining and new SOP for daily stock check. So immediately staff retraining, and it might be your SOP might be lacking something else when these things are getting into deviation. So immediately you have to revise your SOP. What is your standard operating procedure and what is this? Someone has written something. One second. Regular audit at least weekly or monthly basis on safe handling procurement of narcotics, psychotropic drugs. Yes. And the next thing is introduce double signature issue system. See, when you are following all these things, but still there is two whiles missing is not that easy thing. Something happening in your pharmacy, or the person who is carrying from pharmacy to the nursing, the department of usage, or else it might be with the nursing, it might be with the OT. We never know. So what you are supposed to do, you should launch some new SOP as per there might be some flaws with your current SOP. So what is your flaws and why you could not rule out these on a daily basis? You must check it, and nextly then you should publish it a new SOP at the same time, new checklist, so that introduce double signature issue system. See, whenever one pharmacist is issuing the medication, they in charge should double check that this person has issued. At the same time, the person who is receiving also, they should double check, and they have to write as a this one. What is that? Mm, Double check. At the same time, the person who is receiving the medication, it indicates that okay, this person has received the medication and this has been used to the patient. After usage, how we deal with high risk medication, after 30 minutes no ADS has occurred. At the same time, the person who is administering the drug should always sign for the first time. And the next thing is the person who has received from the pharmacy. So there will be a double check from the pharmacy, at the same time double check from the nursing department also, so that we can correct actions for time being. But there should be some preventive measures. So these are the preventive measures for where we are doing all those double check system and checklist will be given, and new SOP will be published, and a proper investigation should be done on a daily basis. You must, pharmacy in charge must check about these daily things, that is opening stock and whatever the closing stock. This is the preventive action where pharmacist can do and the pharma professional, whereas pharmacy pharmacist is playing a very key role in entire hospital in this subject. And at the same time, if you are casual, then that may leads to seize to pharmacy, at the same time to close the hospital sometimes. And at the same time, clinical pharmacist is supposed to audit on a daily basis, and they are though they are pharmacy in charge is checking on a daily basis, but still clinical pharmacist should go for the audit periodically as an internal auditor, so that everything will be ready for any audit or any accreditation. Then we should be always with the ready-made data, where appropriate SOPs and appropriate norms from the NDPS Act, we are using it from the storage to the usage. So let's go for the case study 2, expired narcotic ampules. 5 ampules of fentanyl found expired and still stored with usable stock. So your audit findings are: no expiry alert system, no quarantine immediately, register not updated for the expiry. So what is your corrective action? What is your preventive action? Tell me. See, I have told you, and I have told you the audit findings as well.
As you said earlier, first expired, first out, it should be
Yes,
done.
very good. We have to follow method called first in, first out, and first expiry, first out. And the next thing,
Register should be,
very good, fantastic.
and
See,
auditing also should be done properly.
exactly, audit failure is also there. And here, if we miss and if we found any expired stock which are not segregated from this regular stock, there will be NDPS rule 14. We are straight away, we are violating that rules, and it may leads to the action. That action will be imprisonment only directly, and obviously penalty will be there, and your pharmacy will be seized for duration that might be for 1 week or 10 days. You must not do any billings through the system, only manually. Also, you should not dispense any medication. Then how will you manage hospital? How will you manage critical care patients? You cannot, right? So yes, they'll be very outraged that you are violating the rules. They might not be knowing whether you are using it to the patient or not, so they'll seize it. No, undoubtedly they'll seize it, and it may leads to the penalty, and that is accused may face administrative penalty. Here, if this is going on, apart from the pharmacy in charge, as I told you, even the managing directors are responsible for this, and that can be cited in the NABH non-conformance report. See, whenever this report, whenever we found all those things, then we give complete, that is a big NC, that is a non-compliance report, we'll publish it, and it's not that easy to close it, and strict action will be taken. Sometimes license will be cancelled. So this is the legal importance for this case. And the corrective action, what we can do, as you told, we should maintain a register, that is expiry register, and we have to quarantine the medication that is not for use, we have to label, and monthly expiry review by the quality people, and the same time the pharmacy in the audits, we must sure, we must make sure of it, that is quality, that is regular audit should be done, quality audit should be done. At the same time, proper methods to be followed, that is a first in, first out, or first expiry, first out, or those methods to be followed to make all the medicines to be used on time without expiry or near expiry. So if we follow these things, then we can prevent the medication to be expired first, and if we still medicines got expired with without usage or something else, then we can make it into the expiry register, and that medication should be separated from the regular usage, and we must quarantine those medications, and we should label it as a not for use. And that review, that audit report must be given to the management. Why? Then they'll find the, we must investigate why those medications are getting expired. Either pharmacy in charge might not be knowing about inventory management, or else they are indenting randomly, they are procuring randomly, or the patients might be less, or whatever the reason is, we must investigate what is the root cause. If we go through the unauthorized access case study, security footage shows an intern entering the narcotic cabinet area unsupervised. Can intern enter? Can intern enter that place? Tell me.
No, ma'am.
Why? Why intern are not authorized? They are also from pharmacy professionals only.
But they don't have the access to handle these drugs, ma'am.
Yeah, that is what. He's not authorized, you are saying. I'm asking why.
Mhm.
Ma'am, lack of knowledge of protocols.
Huh?
High chances of substance or drug abuse.
Hmm.
And
I'm
he or she
expecting
can
one point. I'm expecting one point from you. I'm waiting. I'll wait. Who will answer that?
they can enter with a senior staff or someone who might be knowing things.
Yes, yes. Why senior is needed? Why authorized? How can you say that this pharmacist is authorized to open this?
The one who's experienced and they have knowledge in the particular narcotics area
Okay,
about how to handle them, how to store them, and if abuse is there, so how to monitor it and
very
control.
good. Very good. See, a authorized pharmacist in the sense, the person who is holding this PCI, that is Pharmacy Council of India certificate, is authorized pharmacist. Though we have our provisionals, course completion and all, if we don't hold this PCI, we are not authorized thing. See, can you say a doctor without MCI is a registered doctor?
No,
No, right? At the same time, the pharmacy also, the person who is holding the PCA certificate is always authorized. So whenever you are signing this narcotic register with the name, you must write your registration number. So if you are not having those, then you are not authorized pharmacist. And if intern is using this narcotic cabinet, yes, someone told that is a fantastic answer. Some senior who is authorized person, they must open under their supervision, they cannot open on their own. So procurement documentation, safe handling, and disposable management. Yes, these all will be there because PCI, you are writing there, right? Your name and all. So if any intern is using that cabinet and something proliferage occurred, or else mishandled, or else something happened, then who is responsible for that? Obviously, the authorized person who is leading these certificates or who is leading the register is the person who is going to take action from the government or from the drug controller or whomever it is. Intern is not going to be charged anything. but the person who is holding the certificate, or else who is responsible for the narcotic, action will be taken on them. So that is the reason we have to be very careful with this kind of narcotic things. Though intern is going on, their supervision should be there, how they are handling, how they are doing it. You must training is important, but under supervision of your a authorized pharmacist only. So without authorized pharmacist, no one can enter. First of all, only pharmacist can enter, in that also very specifically. In other departments, it might be anyone, even managing director is also not allowed to that place, to open that place. So imagine how power you got, and how much things are there in your hands, where you people are supposed to be handled. And there are some audit findings. Key left unattended by nursing in charge. No access log maintained. No documented security policy. See, intern has left to this place, and key left unattended by nursing in charge, and no log access. Whenever the person has entered that cabinet, you must enter those details. Who has entered, and what is the time, what is the date, and what is the purpose, that is what kind of medication you want, to which patient, all the details to be written. And if any log is missing, then we cannot track. If any medications are missing, or any breakage or something happened over there, we cannot do anything else. So that is the reason of maintaining the access log. And no documented security policy. Yeah, if we don't have any documentation in that security policy also, we don't have anything else to track it. So whole and soul, the person who is leading the pharmacy, who is in the authorized pharmacist, and at the same time the uh, management of the hospital will be answerable for this. So the legal significance in this is, NDPS Act breached the restricted access clause. This is something very important, where unauthorized people cannot enter this place, and criminal liability will be there on a responsible custodian. Because straight away we don't know how these people are being using and all those. So the criminal liability will be there on an authorized person, not on the person who has entered that place. And threat of diversion. See, threat of diversion is equal to always reportable to the narcotics commissioner. So if you are deviating all these roles, then drug inspector will be reporting to the area director, and then that area director will be reporting to the narcotic commissioner itself. And for lifetime, your license may not be activated. At the same time, that hospital may be seized forever, and though you give bribe or anything. And if though pharmacy is open, but license will not be getting again. Once it is cancelled, then it cannot be given by the narcotics commissioner. So these are the threats we have. That is the reason we must use it in a appropriate manner, with the proper SOPs, and with the proper documentation, that is a usage from the prescription to usage, that is written vials also. So hope you have understood why this is very important. And what is the corrective action for this? Hope I have cleared all the case studies. Now I am expecting the corrective action from you itself, corrective action and preventive action. Tell me. Anyone. If it is wrong also, that's totally fine. It's appreciated that you have come to answer something else on this platform. So something is better than nothing. Answer. Anyone? What is the corrective action for this? You want me to tell? Tell me that. I'll tell you. Am I audible to everyone?
Yes, ma'am. Ma'am, from the pharmacist department, while procurement and dispensing of the medicine, they have to maintain the record. And
Yes.
in the
How
nursing
procurement?
department, while while
1 minute. I have doubt.
administrating to
I have
patient,
one doubt. 1 minute.
double.
Can you clear my doubt? How procurement is involved in this unauthorized access?
Yes.
No, it's my doubt. I am not questioning you. It's my doubt.
Yes.
How they are involved?
Ma'am, the staff might not have updated the record, maintenance record, and they would have placed the order.
But procurement is nowhere involved in operations. So that is something different department. So just yeah, tell me. You can tell me complete answer. I can tell you what are the things. Yeah. Next thing you are saying something.
And during when it went to the nursing department, they will check. They have to double check before administering to the patient whether it
Yes.
got expired and all the
Yes.
things.
But how it is impacting this unauthorized access? See, there will be double lock and key, right? See, procurement is something completely different from the operations. That is your department. See, you are working as a pharmacy in charge. You are leading whole and soul things. Whereas I'm the procurement person. Let's think. So how can I get into your place? That too, narcotics, which is very keen in using those, and we are keeping the CC camera and all. First of all, I'm unauthorized person to enter in your place. First thing is, and the next correction we are supposed to use it is double lock and key. Whenever we are using double lock and key, without key, how can they open? Though they get into that access cabinet, how can they open? They cannot, right? So the corrective action is always it should be locked. It should be double lock and key should be maintained. And yeah, obviously lack of sincerity, the people who are not sincere only they do all those kind of mischiefs, enter into these prohibited areas though they are not authorized. I completely agree with you. But second thing is, main thing is double lock and key. See, keys are you with you and other person. Though I go to the cabinet, what can I do? I cannot do anything. I cannot open it first of all. So it should be locked. That access should not be there for everyone. There will be two keys will be maintained. One will be anesthetist, one will be pharmacist. If anesthetist is not there, then that will be there with the nursing in charge only, and these keys will be there only with in charges, not with the staff. And that is the first corrective action. See, we cannot stop the people, as someone told that lack of sincerity. See, we cannot correct everyone which are which whom they are completely disobeyed from the things. So we cannot restrict those kind of people. What we can do is we can lock the system. We should keep lock, that is keys with it will be with only two persons. One with authorized pharmacist, one is with anesthetist only. If anesthetist is not there, that will be shared to the nursing team. So we can prevent that unauthorized access. And next thing is, uh, next thing, can anyone tell next thing?
Proper documentation.
Yes, very good. Next. What we can do more than this? We have to do audit on a regular basis. Whenever we do on we do audit on a regular basis, though it got into the proliferage and everything, we can identify. And whenever we got doubt or anything, obviously that cabinet will be with under the CC vigilance itself, so that we can track. And next thing is audit, double lock and key. logbook entry, right? Yes or no? This logbook entry, first of all, we are maintaining this double lock and key. The system we are trying to enforce it, and that entry should be freezed with biometric. Without biometric, usually, I think there will be a lot of biometric system in your colleges, right? Do you have any biometric access for your attendance?
Yes, ma'am.
See, if you click that, or else if you stamp that biometric itself, then you are authorized to get into your college or else to your workplace. So gates will be open automatically. So we have to keep any biometric entry, and we should keep the log access logbook. See, anything we can do, but if we put either thing, that would be more helpful. See, whenever we see the CC camera and all, some people has went to the biometric, they got in but they did not write in the logbook. It might be intentional, unintentional. So whenever we find something is missing or anything, we can go for the logbook. Then if they don't write in the logbook, then we can identify, we can investigate whether it is an intentional act or unintentional act. We can find the proper root cause. So both should be maintained. And regular staff orientation on a legal accountability. See, now as we are discussing, these many things will be there legally if we don't follow these SOPs. So if we don't discuss all these things, then can we able to know what are the legal things, or else why we are supposed to maintain all these things? What implications can be done? Can we know? Can we know? Till now, see, I want to ask one question to everyone. Narcotic audit in your workplace or else in your internship, interns are not allowed. But still, if you are working, did you see any time what are the narcotic drugs and what are those? Did anyone see? Is everyone feeling sleepy as this is Saturday? Everyone is in weekend mode. Am I audible? Did anyone has seen this fentanyl, morphine in the case sheet at least?
Yes, ma'am. Yes, ma'am.
Okay.
Yes, ma'am.
Did anyone see in the pharmacy how it is stored? If you have not checked till now, you try to
No,
apply
ma'am.
all these NABH rules and whatever you are learning here, you can audit it your workplaces or else your internship or whatever the places you are working for. You can work as a auditor, and you can go to pharmacy and you can go to the wards whenever these medications or high risk medication in the case sheet were observed. There should be double lock and double entries, double check system, and narcotic should be stored in a double lock and key. A proper narcotic prescription should be maintained. You can apply all this knowledge there, which is useful for you, and you can work as an auditor in your workplace only. With this knowledge, see, these are the latest guidelines and these are the mandatory, though it gets into the fifth edition, sixth edition, or 10th edition. These are the mandatory things what I'm giving information to you. So, if you have not observed till now, try to find out all these things and try to apply this knowledge in your daily routine at your workplaces. Okay, and hope you have understood what is the implications if we violate the NDPS rules, and what are narcotics, how it is supposed to store, and what is the prescription process, what is the register format, who should follow it. Hope you have understood. Yes. Can we leave? Chalo. Hope did you understand what we have gone through these narcotics? And if you don't apply this knowledge till now in your workplace, or if you know any pharmacies or anything, only hospital pharmacy will be leading these narcotics. No outlets will be leading these narcotics. Try to go your places on Monday or tomorrow. You can check all these things which are very important. Okay. Shall we leave?
Yes, ma'am.
Okay. Chalo then. Happy weekend to all.